think we're set now. So just a little background, as I mentioned, we cover 3 hospitals in Southern California. We have 911 beds. We primarily focus solely in pediatric healthcare. We have over 100 primary care clinics covering San Diego County and Orange County, as well as Riverside County and San Bernardino. Over 150,000 inpatient days and over 1 million subspecialty and primary care visits annually. And Rady Children's Health is the merger of 2 health systems, Children's Hospital Orange County and Rady Children's San Diego, representing a workforce of just over 15,000. I want to spend a little bit of time talking about our digital vision and strategy, how that translates to all of the merger integration work we're doing, and then kind of end with a bit of our approach to AI in healthcare, particularly pediatrics. So from a vision perspective, we really want to focus on meeting our patients in whatever way they want to engage with us in any channel. And as part of that, we look at our digital experience from just someone looking to consume our services all the way to us providing those services and then trying to make sure we can retain and keep them as part of our health system along their entire healthcare journey. One of the main things we know is 71% of our patients want to engage digitally, and from a patient satisfaction perspective, our satisfaction is 3 times as high when we engage our patients in digital channels. As this slide represents unified patient health at the center, everything is patient-centered focus. We want to engage our patients, whether it's via the web, whether it's via mobile, whether it's via an AI chatbot. All of those means we know our patients and patient families have different ways in which they want to engage with us, and we want to make sure we're able to meet them in the best way possible. One of the components related is in kiosks. We built a new specialty tower that came online 1 year ago. We don't have any information desk at the front of each of our clinics. It's all digital. 70% of our patients check in before they arrive. Once they arrive, they let us know they've arrived, and they come back and are ready to be seen. Our goal is to get that upwards of 85 to 90% check in before they arrive. So we still have some more work to do, but we're pretty satisfied so far with the progress we've made. So now I want to spend some time on the integration. So while we're implementing these digital tools and channels to connect with our patients and provide services, we also have to lay a foundation to bring these 2 organizations together. That's focused on bringing our cybersecurity programs together, focused on bringing our collaboration tools and email to the same platform, as well as singular identities across all of our health systems. That's the primary foundation. Secondly is unifying our core software applications. So from a financial, human resources, payroll perspective, supply chain, we're implementing Workday with a target go live of January of 2027. We are unifying our KISS, our electronic health record. We have 2 different platforms. We're unifying on Epic as the singular platform. That will take us through fall of 2027 before we unify those platforms. And then creating a central data and analytics platform that covers our entire health system. That's phase 2 of our integration journey. The last phase really takes place once we've integrated and laid the foundation, unified platforms. And that's really about optimization, leveraging AI to really advance how we deliver care, but also how we fundamentally function operationally day in and day out. A lot of information on this side, but the main takeaway is we have 900 applications between the 2 merged health systems. And part of what we wanted to approach is to shrink and reduce that number. We have identified 300 applications that we will eliminate. And the focus is unifying those systems, eliminating redundant applications, renegotiating contracts to really drive economies of scale. With the reduction of those 300 applications, we're targeting 10.5 million in annual savings out of our operating budget ongoing. Now I want to spend a little time on our AI technology roadmap. This is really building the bridge from the digital experience and how we leverage those tools, laying the foundation with the data platform, and how we can begin to take advantage of the wealth of information we're bringing together. So It has to start with governance. From an AI governance perspective, we had two different governance models. The goal is we're transitioning to one enterprise governance model to manage and help us focus on the most important aspects of AI from a clinical delivery perspective, as well as an operational perspective. So what we want to do is have sub-councils focused on clinical technologies, make sure we have the right oversight, make sure we have the right risk profile of the models we want to introduce at the point of care, and then also focusing on research and innovation. We have a genomics institute that does rapid whole genome sequencing. We want to be able to take advantage of that wealth of data, tie that to the other translational research that we're doing, and be able to really have an impact at the bedside, leveraging that information and improving how we deliver care and identify and diagnose our patients. So getting to a single governance model, first step is building a single charter. Second step is identifying the different councils, as I mentioned, focusing on clinical delivery, operations, as well as research and innovation. Building out those sub-councils, populating those with the subject matter experts, and assigning data scientists and data engineers to support the work day in and day out. And then finally, getting that implemented and fully functioning. Our goal is to have that completed by June of 2027. By then, we will be moving forward with unifying our EHR, and that gives us the foundation to really begin to take advantage of the unified platforms, harvesting all the data that we've began to acquire, and really start to use that to drive improved outcomes for our patients. So we have really three pillars of our approach to our AI delivery model. So one is focus on internally developed predictive models with our data science team. We have a number of those already in production, integrated into our electronic health record to prevent and identify sepsis before patient deteriorates too quickly, so we can intervene and prevent adverse outcomes. We also have a rising risk model that we've introduced that really looks for anyone in our pediatric ICU population, really identifying vitals, looking at all the orders, looking at everything around their care, and really trying to identify if anyone is at risk for deterioration, so we can be in a position to notify our caregivers and be able to intervene before things take a turn for the worse. We also have a couple of other models related to no-show prediction for our specialty clinics, as well as for our mental health outpatient center, really looking at how we can create some prediction around any of our patients who are at risk for harm or harming themselves, and giving us an opportunity to perform some interventions before that would take place. That's still in the early stages of validation. We're hoping over the next 3 to 5 months, we'll be able to introduce that into our production environment and be able to see that being utilized on a day in and day out basis for that particular population. The other component is just every software company now is an AI company. And so one of the things we're focused on is how do we understand if those tools are really provide value, and if they do, and we already own them, we want to maximize those, get those introduced, and take full advantage of those. The third component is the deployed approach. And for me, this is probably the most exciting. This has to do with Gen AI, whether it's a Claude, whether it's OpenAI, whether it's Gemini. We've landed on Claude as our platform. We've introduced this internally, our own private LLM, and our focus right now is on productivity, clinical content delivery, and building some purpose-built applications specifically for our clinicians, but also fundamentally trying to change how our organization leverages these tools to become more and more productive, to accomplish the work that they have to without having to grow the team, without having to grow your workforce. One of the challenges that we're facing in the States is a lot of cost pressures. And in order for us to counteract that, we either have to find more incremental revenue for more services that we're providing, or be able to provide more efficiency in how we deliver those services. And we see the deployed LLMs, private instance that we're building products against as a way to counteract the cost pressures. As I mentioned before, our research and innovation unit is really one of the areas where once we get through building that foundation, unifying our platforms, we really want to optimize and innovate from a research and innovation perspective. So I mentioned efficiency. That's one part of what we want to do from a productivity perspective. Differentiation is how we begin to use these tools to really drive our efficiency and how we deliver services and care across the health system. But really the last piece is how do we disrupt pediatric care delivery? And we believe that leveraging our Genomics Institute and the wealth of data and research that group is providing, along with our other research centers, we're going to be able to really disrupt how we identify problems, identify and diagnose rare diseases for our patient population, and be able to leverage this research and these capabilities to treat them in a way in which we're not able to treat them today. So really excited about getting to that point. But as I mentioned before, first we had to lay the foundation. Second, we have to unify the platforms. Then we can optimize to try to deliver these capabilities. That really translates to an intelligent pediatric health system, which is our overarching goal with building these capabilities out. Transforming tomorrow is kind of our tagline for our health system, and leveraging these platforms, particularly at the scale and pace in which they're advancing, is really how we see us creating that intelligent pediatric health system from a delivery and being able to be as effective as possible with the resources that we're investing in. And lastly, one of the biggest things with our merger is about bringing these cultures together. You can lay the foundation, you can unify the platforms, but if you don't create the right culture and merge the cultures to create your new culture, your new fundamental way in which you work, then all of the work that you did previously won't really translate and won't be sustainable. So one of the things we have to make sure we're focused on is understanding how much we're asking our teams to deliver over this short period of time. How do we create space for them to decompress? How do we create space for them to recharge so that we don't overwhelm them with the various work streams, unifying the platforms, laying the foundation, and then also still trying to create a digital experience for our patients all at the same time. So we're very conscious about how we approach that. And we're also focused on how do we really bring these teams together when there's uncertainty. And part of that approach is having quarterly informal social sessions where we bring the teams together, talk about our challenges. What do they need from us from a leadership team? What do they need from me as a CIO and digital officer? And how can we help advance and support them in a way in which they feel heard, but also in a way in which they understand there is going to be a better path once we get through some of this really hard stuff that we're doing. And lastly, one of the things that we're doing with this merger integration, this doesn't really happen in the States where pediatric health systems combine. So this is really rare. And so we took this as an opportunity to figure out how do we invest in our future and sets us up for what we need to do to build that pediatric health system that I mentioned, intelligent pediatric health system. And part of that is laying that foundation, governance, creating the types of pillars around productivity, differentiation, and disruption, and then taking advantage of an operating model that allows us to deliver the best type of services in the most efficient and effective manner possible. And as we come out of the merger, the biggest thing we want to make sure we focus on is making sure that every part of our organization, regardless of the demographic, everyone is focused on digital and how we provide services, how we deliver the work day in and day out. And lastly, how do we become AI native with these tools? Because they're going to be ubiquitous across our organization, and we want to make sure we were prepared to meet them at that point of attack. And with that, that's all I have for you.